Hi, everybody. I just wanted to briefly go over a couple of hygiene points. We have covered almost everything on these hygiene slides in lab, but these slides are located in Moodle in week 3. And I do suggest that students familiarize themselves with what's on the slides and compare it to the textbook, just because anything that's in the slides or the textbook or any presentations or labs can be on an exam. So hygiene has been covered. I wanted to just make you familiar with the slides a little bit, though. I do have the objectives here for you, and the objectives are always a great place to start when you're studying and making sure that you understand the concepts enclosed in those objectives. We talked about this in lab, the factors affecting personal hygiene. For history and physical items, most of this is review from your H&P course, but I put these in here to draw your attention to things that we focus in on the skin. These are things that we talked about in lab, but know that you can also review these in your current textbook. So I'm not going to go over any of these because we have covered these. Do make sure that you review. If you missed anything in lab or you've forgotten anything from assessment, make sure you review this closely. We've talked about oral care quite a bit. When we're talking about, one thing I wanted to reiterate from lab is that when we're talking about the things that nurses do for patients, it is this entire list. Assisting with toiletry, providing comfort measures, washing their face and hands, providing oral care, bathing, and even a back massage. We clean up the bedside, we dress them, we refresh the bed linens, we do hair care, and any kind of special skin lotions that are ordered by the physicians, we make sure that we put on them. We covered all of this in lab. We didn't really talk about massage. Nurses don't have a lot of time anymore. So we don't provide those huge massages like you think of back in the day that nurses did. But I will tell you that I began implementing an evening back massage with my patients. Just a brief, let me listen to your lungs, put a little lotion on your back. I'd have them lean forward, warm the lotion in my hands, and rub it on their back after I listened to their lungs. And it really did help them go to sleep. My patients slept well. They felt like they knew I was there for them if they needed me, and it didn't take any extra time at all. And it was really a comfort measure that made a huge difference in my practice because my patients slept better. My call lights were not going off as much as other nurses. It was good for my patients, and they rested better. So consider that as you move forward in nursing. We do that every morning, all of that care. Some care will be in the afternoon. We call that PM care. I just want to make you familiar with the terms. I know we've talked about this ad nauseum. And then hour of sleep care, we like to go in and offer these things again. So in the morning, in the afternoon, and then before they go to sleep at night. Also, of course, as needed, PRN care. If they need anything in between those times, we're going to come in there and do it. Oral care, we're probably going to be doing it every 2 hours on many people because it does decrease hospital-acquired pneumonias. And when someone is diaphoretic or incontinent, we may be changing their linens every hour. So this is stuff I just wanted to reiterate. These are all things we talked about in lab. And I'm not going to repeat most of them. You can review them. I did want a word. This is the whole reason I'm doing this video is for perineal and vaginal care. I did talk to you in lab about for when we clean someone's private area that we need to ask their permission. If they're not awake, we still need to tell them what we're doing. If they're not sleeping, if they're in a coma, if they're unconscious, and we're going to clean their private area or any area, we're going to tell them what we're doing as we go, because we know that people can still hear us, and no one would want to be unconscious and have people touching them without knowing why. So it is particularly important when we're talking about a person's private area, their vagina, their penis, their buttocks, areas that are very sensitive, their breasts for men or women. A couple of safety items here. When you are cleaning a man's penis. If he has a foreskin, you need to pull the foreskin back, clean under it, like retract the foreskin, clean under it, and as soon as you're done cleaning and drying, pull that foreskin back to its original position. If you don't do this, you can cause circulatory damage to the penis and can cause him to lose part of his penis. So always when you retract the foreskin and cleanse, always pull the foreskin back in the previous position. And you're always going to clean from the cleanest area to the dirtiest area. So you're always, the tip of the penis is the cleanest because that's where the urine comes out, and you don't want to get any dirty stool or anything down there by the urethra. So you're going to clean from the urethra back towards the body to keep the risk for a urinary tract infection low. In women, you're going to clean from front to back, always from front to back. You don't want to bring any bacteria from the anal area up to the vagina or the urethra. You're going to start up at the urethra and clean back to the dirty part. So that was the main reason I wanted to talk about hygiene with you today at all. And I think that was all that we hadn't covered. There is a safety issue on ear care. Never use Q-tips in the ears. Don't even go near the ear with a Q-tip. Use a washcloth and clean the ear. But don't use a Q-tip to go into the ear. And you can have a person blow their nose to clean the nose. You can use warm, moist compresses around the nasal area if it's crusty, but for the most part, it's the ear that we're really concerned about, not sticking anything into those ears. And I think we talked about everything else on here, and that was pretty much it. One thing on skincare, teaching skincare, I didn't mention that you do need to remind your patients that they need to check for ticks. You may have to teach this to parents. If they have children who are out playing in the yard, you may have to teach them how to check for ticks all over their body, or remind them of how to do it, and also talk to them about sunscreen use. And some folks need to use milder cleansers. Folks who have autoimmune disorders, particularly lupus, need to use very, very, very mild soaps and shampoos because they can cause damage to their skin and they can cause hair loss. So you'll need to teach that skincare to your patients or to the parents of your patients. And